Good evening, ladies and gentlemen. If it was a small talk, I would have tried to talk in Malayalam. I would have asked somebody to write for me the script in Malayalam and spoken to you in Malayalam. Unfortunately, it is a little lengthy, and my knowledge of Malayalam is very, very limited. From my beloved colleagues in the Cabos Hospital, I learn Vorminter and small things. So I will, with your due permission, speak to you in English, but I will try to be as explanatory as possible. So tonight, ladies and gentlemen, I am not going to scare you, not going to put a bombshell on you, just give you simple information about H1N1. What is H1N1? And subsequently, my colleague Dr. Mohammed Baki, along with Dr. Elias, would go and tell you the details of treatment and vaccination in English and Malayalam combined together. So let us welcome all of you to Salalah tonight. I have put 4 pictures, and I am sure you cannot tell me which is Kerala and which is Salalah. So close is Kerala's natural landscape to Salalah's landscape that we could very proudly say Salalah is home away from home for all of you ladies and gentlemen from God's own country. And this is the beauty of Salalah, and we are really privileged to lead our lives here. That was beauty, now the beast. Is H1N1 present here? Yes, it is present here, but all the lions and all the tigers are under control, and they are behaving in a very disciplined manner. The disease process is very much under the control of the preventive and protective measures of the Ministry of Health. So what is the most common fear, or what they say in Arabic, cough, in everybody's mind? Whenever I get a sore throat or fever or body ache, do I have H1N1? Well, ladies and gentlemen, you could have H1N1, but you yourself cannot know whether it is H1N1 or not. The whole idea of telling you this important thing is, if you think you have cough, sore throat, fever, body ache, you need to go to a doctor. Don't sit at home, because you yourself can never know if you have H1 or N1. So what are the symptoms, the signs that you should really take seriously? If you are an adult male or a female or a grown-up child, if you experience shortness of breath, persistent vomiting, confusion, dizziness, giddiness, altered behavior, altered sensorium, please don't sit at home. Please consult your doctor immediately. All mothers, we are very happy to see so many mothers with their children. If you think that your child is breathing very rapidly, बहुत तेजी से दम सांस ले रहे हैं, or the child is not feeding properly, child is very lazy, irritable, sleeping, does not want to eat, does not want to play, बच्चा सुन्न हो गया, खा नहीं रहा है, पी नहीं रहा है, चिड़चिड़ कर रहा है, then please think that there is something wrong with the child. Take your baby to, this is a very healthy cry, this is a very healthy baby. So, ladies and gentlemen, what should you do when you have the illness? If you think for more than 1 or 2 days you are having fever, body ache, sore throat, don't go out and tell everybody, oh, I have fever, I have body ache. Take rest at home. Drink lots of warm fluids. Cover your nose and mouth when you are coughing and sneezing. And then after coughing or sneezing, please don't do this. Use a Kleenex. Wipe your ear and throw it in the dustbin. Then don't go around in city wearing a mask. You are not Superman, you are not Batman. Wearing a mask will not protect you, it will harm you more. Because you are creating a moist environment around your nose. And please go and see your doctor. So, all these things, as I told you, if you have this problem, if your wife has this problem, if your children have this problem, don't sleep at home. Please run to the doctor. I'm going to say this again and again. And why am I saying this again and again? Because, ladies and gentlemen, one very important statement I'm about to make. 95% of the people, you all, me, all of us, if we get H1N1, we won't even come to know. It is not that dangerous. It will be like common cold, flu. It will come and go. But there are some people, if they don't take the proper care and proper precautions, they can have serious problems. They can even die. So you have to take the precaution. Don't wait till the water comes here and then you start swimming. Can you travel around the whole of city? Hello, salam alaikum, how are you? When you have cough, fever, sore throat, please don't. Stay at home. Don't give the virus along with salam alaikum. Because you are going to spread the infection in the community. As I said, are some people more at risk? Yes. The very small children, children less than 2 years, very old people, people with diabetes, people with hypertension, blood pressure, people with asthma, people who are taking medicines for some cancer, people who are taking medicines for tuberculosis, people with rheumatoid arthritis, chronic debilitating illness. These people, you have to take extra care and extra precaution. If you feel you have zukham or flu-like symptoms, please don't waste time. Go to the doctor.